Please. Thank you.
Good afternoon. I'm going to be talking about type 2 macular telangiectasia with CNVM in young female. So coming to macular telangiectasia, it has been classified into three types. Though it is a very rare condition, amongst the three types, type 2 is the most common. It is bilateral, acquired and slowly progressive degenerative condition of the macula. Mactal type 2 is generally seen in perifoveal area. The term mactal is often used to refer to mactal type 2, and most commonly it occurs in the age group of 50 to 70 years. So though the etiology remains mostly unknown, but it has various hypotheses theories have suggested it to be a primary neurovascular degenerative disease which affects primarily the Muller cells, which are the principal glial cells in the retina, and the RPE cells, as well as retinal vessels, leading to loss of the photoreceptors. And CNVM appears in the last stage of the disease progression. This is a stage at which treatment needs to be given. So coming to the case, it is a 38-year-old female complaining of diminution of vision in both eyes in 6 months, insidious in onset and gradually progressive. There is no history of trauma, redness and pain. She is a known hypertensive since 2 years on medication. But since the presentation of macular telangiectasia, like we suspected macular telangiectasia, we have also told her to get investigated for diabetes, where she was diagnosed as diabetes because her HbA1c came out to be 9.88%. So on ocular examination, her visual acuity was 6/60 in right eye and 6/18 in left eye, remaining everything of the anterior segment to be normal. But coming to the fundus examination, the right eye showed fundus shows foveal and perifoveal ectatic vessels with venules diving at right angles into deeper retinal layers. Usually the macular, the vessels near the macula, they taper off and they are not present in the foveal area. But here, because they are ectatic vessels, and they do not taper, it looks like they're diving at right angles. And there's great discoloration of the perifoveal area. And RPA hyperplasia and pigmentation can be seen at the superior temporal fovea, where the disease usually starts, and with mild scarring in the right eye. So disease is worse in the right eye compared to the left eye. And we did fundus autofluorescence to see the amount of RPE cell damage which is there. So FF shows areas of hypoautofluorescence in the area of RPE atrophy and hyperautofluorescence suggestive of stimulated RPE. And we did OCT and OCT-A, which is the diagnostic test modality in this. So OCT shows loss of architecture of inner retina with type 2 CNVM in the right eye. And OCTA superficial layer shows venules diving at right angle into the deeper retinal layers. With dragging of vessels to the epicenter, and outer retinal scan shows fine lacy network, which is not supposed to be present in the outer retina as it is avascular. And similarly in the left eye, but right eye is more affected than the left eye. So what is unique is usually the age of presentation is 50 to 70 years, but this lady being young, it just makes it a very rare thing. But there has been cases with younger presentation as young as 18 years also. And because she's diagnosed as uncontrolled diabetes, we have to be vigilant in ruling out systemic conditions as the MACTEL project, which is the largest project, and it is an ongoing trial. It has shown evidence of diabetes